If you're planning to have kidney transplant, you're on dialysis and you want to have kidney transplant, please watch this video. Even if you're not the one, please send it to anybody that is on dialysis that is planning to have kidney transplant. Because at the end of the day, it's not about the transplant. You will see someone that just had transplant and the kidney fails after 1 week, or even it won't even work. These are the things, and most people they find it difficult to get a donor. Okay, they are getting donors, people that are giving them kidneys, but the is not matching. Okay, so these are the things that will help you have a successful transplant by the grace of God, and your transplant will last. Your kidney transplant will last as much as the grace of God allows it to. So watch this video, listen attentively. This video is called Having a Successful Transplant, and I'm also going to be telling you about post-transplant kidney transplant care. It's not about having kidney transplants. There are things you should do that will make your kidney transplant last 10, 12 years, 15, depending on how much you take care of that transplanted kidneys. Now let's get to it. Number one thing you should do if you are about having kidney transplants, please, I beg you, have a good dialysis. Try to have a good dialysis. Now, most patients, you tell them to have a good dialysis, maybe they need a line, a central line, or the line they are using is not good, and you're telling them to have do a central line, do this. They say, no, I want to do kidney transplant. Don't worry, let me manage this femoral that I have. I want to do kidney transplant. See, you need to have a good dialysis first. The urea, the creatinine, your level, your blood levels, everything about your system needs to be normalized to a certain level. This is because so that when the new kidney comes, remember is one, when the new kidney comes, it doesn't have so much stress. There's no so much strain on it. Now, when you have a good transplant, the urea, your creatinine level, they will decrease to a certain amount of level that is acceptable. You will not be so bloated. The water, everything will, be near normal, right? So this will help the new transplanted kidney to work effectively without any stress or any strain. Okay. Number two is blood transfusion. Avoid blood transfusion as much as you can. Now, I know that most people kidney transplant patients, people that are on dialysis, their major problem is low blood level, PCV, because the kidney is no longer working. So it's the kidney that helps to bring up the blood levels up. Okay, so because the kidneys are no longer working, their PCV are always low. Blood transfusion, when you take a lot of blood transfusion, it will make a lot of antibodies that that blood is not for you, so it will make, it's not from you, it's from someone else. It will make you build a lot of antibodies. So when you do kidney transplant, these antibodies may attack the new kidneys, and there will be a high risk of rejection. The new organ, your body will not accept it because there have been a lot of antibodies in your system. And also, second thing that this will happen, because it will make you to have a lot of there's this thing we call plasmapheresis, and it is very expensive. It is filtering out it's like a dialysis, but this dialysis now is for the plasma. It's trying to cleanse your plasma from all of those antibodies that you must have gotten from the blood transfusion that you took. And you can do as much as 5, depending, as much as 6, and one section is about 800,000. So you can imagine. But if you did not take a lot of blood, you did not take blood during your dialysis, you can they will test you and they'll find that you don't have a lot of antibodies, or you don't even have anyone. You just go ahead for your dialysis. Now, number 3, I've mentioned 2 things, that's blood transfusion and having a good dialysis. Number 3 thing that you need to do is, please don't rush. Don't rush kidney transplant. I know you have the money. I know you have the resources. Now, this is a very gradual process. This is something that you need to calm down. When your doctors tells you that you're not ready, don't pressure them. I see this a lot of times. At the end of the day, the doctors, they will just, just to give in to you, especially let me not just go there, but don't rush. Stop rushing the doctors. Stop asking them, when is my surgery, when is my, they tell you we are waiting for you to heal. They tell you we're waiting for this to happen. They tell you we're, just calm down. Now when you're doing excuse me, when you're doing finding a donor, finding a match and all of those things, they are not forthcoming. Calm down. Please calm down. Just take your time. Let the doctors run the test, run everything. When your time comes, when you're being scheduled for surgery, then you can go do your surgery. Right. Now, the number 4 thing that you should do to help increase your chances, the longevity of your kidney transplant is this. Most people do not know this, and this is very important. It is not about doing kidney transplant. The drugs are expensive. Now, if you don't have drugs for kidney transplant, I tell people, not only me, my doctors, my ogas, my consultants, they tell people, don't do that. Money that you want to use for transplant, you can be using on dialysis. If you don't have money to purchase, the drugs are expensive. This is a lifetime something. If you don't take that drug in a day or for 1 month, or maybe they tell you to take your drugs 3 times in a day, and you take it, maybe you are now rationaling it because of money, you now start taking them maybe like once or twice in a day, that kidney will fail. It will fail. Now, these drugs needs to be taken so that your immune system will not be so active to find out that that is a transplanted organ, that is not their organ. Because that is what happened. The drugs are immunosuppressants, okay? They reduce, your body's ability to understand that that is a foreign, because if you don't take them, your body starts noticing that, oh, that is a foreign organ. That organ is not from here. They will start attacking it and the kidney will die. So you see, you need the money. So as you're asking people for help for kidney transplant, ask them for help for the medications. Okay, so it's not about after asking them for money for transplant, then after the transplant, you start asking them money for medication. Most people would think you're fraud, or you're just, so they will think that you're doing it, that you're not, legit or something. You're just trying to make money. Okay, so as you're telling them about your kidney transplant, even if they don't give you money, be telling them, let everybody be preparing, your family members be preparing about the drugs money, and keep a certain amount of money for the drugs in case maybe you now start doing your business to get more money, right? That's the 4th thing. Number 5 thing is take your drugs religiously. On no account should you rationalize your drugs. If you've done kidney transplant or you want to do not rationalize that drug. If they say take twice, and let it be the exact time that you take the others. This is your life we're talking about here. Okay, I've seen a kidney transplant that lasted for 15 years. So you can see. So take your drugs. If at any point you stop, 2 months is I said to 2 weeks is enough. You will see yourself start swelling, you stop urinating and stops. So start take your drugs the way it is. And another thing is, make sure you come for checkup. That's the number 5th thing. Come for checkup. Come for checkup. Come for checkup the way your doctor says you should come for checkups. Okay. And now these patients are plenty. Okay. Most of the times your doctors might not remember to call you, or just come. It is your life. Come. Now, the 6th thing is, make sure you update your test results. Try to check your test. Always check how the kidney is doing. Now, in the area of updating your test results, make sure you check your diabetes, your sugar level. Now, because these drugs has the potency of increasing your blood sugar level, and so if you become diabetic in the process of taking that those drugs for after transplant, you become diabetic and you don't even know, the kidney will still fail. So you see, this video is just life after kidney transplant. Okay, please make sure you check your sugar level, come for a checkup, update your test result, know what is happening in your system, take care of that new kidney. Okay, after taking your drugs as prescribed, the next most important thing, after kidney transplant is prevention of infection. You know, these drugs are bringing your immune system down so that it will not attack the new transplanted kidney, because it's trying to make your kidney not to know that this is not the kidney. Okay, this is not your body, like I explained. Okay, so the next thing is to prevent infection, because your immune system now will be down, and to get infection is very, very easy. That's why you see before transplant you'll be told to wear your face mask. Do not joke with this. Most patients joke with this. Do not joke with this. Try to be very sensitive about your health. Okay, now after that, if you notice any early signs of infection, if you start having fever, please don't wait. Go to your hospital and go to your doctor. Now these drugs also, depending on the one that you're taking, okay, some of them some of them also may increase your blood pressure. Okay, and so this is why you should monitor your blood pressure, monitor your sugar levels. I've explained, because they can also increase your sugar level. Okay, so monitor these things, and if there's any deviation, just go to your doctor. Okay, and now do not go back to your normal lifestyle. This is a mistake. I know you're excited. I know you're excited because you're happy you've done your transplant is successful. Please do not go back to your old lifestyle. If you used to smoke, please don't smoke. I've seen a lot of lapses. People, they will still go back to what they were doing and still land to square one. Remember, you are taking, not only do you have that kidney that is transplanted, you're taking drugs too that the kidney will also have to work on, so you don't need to stress it much. Okay, unlike the person that transplanted the kidney for you, the person can do whatever he or she likes to a certain amount. Okay, but you're taking drugs too, so you should always try to eat healthy, reduce protein. Okay, you can eat fish, continue eating fish. Okay, reduce protein, try to be healthy as small as you can. Okay, do exercises, drink water. If you must take alcohol, I know you've missed alcohol a lot, but small. Drugs you're taking, be careful. Okay, this will help you, and this will help you a lot to make your kidney last. Please be mindful of infection. If you have malaria, because malaria is not good for the kidneys, now another thing is this. Please, I'm not trying to be a religious fanatic, but pray, ask God for direction. He can heal. There's nothing that he cannot do. I believe in God too. I believe in him. So make sure you pray. Always put God step all the way forward. Ask him what is direction for protection during your time of surgery. Make sure that God is involved so that everything will be exceptional for you. Now, these are the things that you will do to I believe in God. There's nothing he cannot do. And I forgot to mention, very important, in the aspect of updating your test results, checking your blood pressure, your blood sugar level. Also check your blood pressure, because these things might also increase your blood pressure if your sugar level is high and all of those things. So make sure you monitor these things. Do not joke with them. If you have anything, you're noticing anything, make sure you speak to your doctors. Now, let me know about any question you have in regards to kidney transplant, and I'm going to post a video about those that their dialysis, their PCV is always low, how to increase your PCV. Okay, because I'm a renal nurse. I'm practicing in one of the best. One of the best. I'm not hyping. My hospital is the best in West Africa. So how to increase your PCV, how to know you're having a good dialysis, how to know that you're not having a good dialysis, and how to have adequate dialysis. Now, like this video, share. Let me know if you have questions. Chat me on my on my Instagram, because my Facebook is full, on my Instagram. And if you want to meet a nephrologist, I'm going to direct you to one. Like, share, follow for more.